First of all, let me ask, how long have you been the commissioner?
For 4 years.
For 4 years, thank you. And you did talk about placements done at the local level by the judge. And we look at the list in the classification of facilities. So we know that the local judges place individuals in the secure facilities. Is that correct?
Yes.
And are the people placed in the secure facilities, are they limited to juvenile offenders, or does it include more offenses, those that have committed more offenses?
The majority are juvenile offenders.
Are there
Vast majority.
Are there juvenile delinquents
No.
in there as well?
No.
We have the other range, starting from limited, secure, non-secure, and then, of course, group homes and so on. Does your department have the ability to change the level of the placement at all in these other places? From limited, secure to group home, for instance?
Yes.
And how does that process work?
There would be a hearing. There would have to be a hearing to change the level of placement.
And do you make that decision?
There's a case review. It is made, in some instances, it's made by the agency. In some instances, it's made by a judge.
Well, can you take me through it? Let's say that there's somebody in a limited, secure facility. How does that person move to a non-secure facility or to a group home? Can you take me through the process?
No, through our intake and reception center, when a young person first comes into placement with OCFS, they're either assessed for a non-secure or a limited secure. If after they're placed with us, you're talking about a movement downward.
Or upward.
Or if it's to be moved from a limited secure to a secure, that would require judicial hearing. Not always?
Based on the case needs of the young person.
I'm sorry, I didn't hear you.
A young person could move from a limited secure to a lower level care based on the treatment needs of the child.
Right, but not to a higher level of care. You need judicial.
Yes, you can't move up.
You can't move up. You need a judicial order to move up.
Let me take a step back. The way I understand it is that in order for somebody to be placed in a secure facility, that placement must be done by a judge.
That's correct.
If they are not placed by a judge in a secure facility, but they are then placed under the jurisdiction of your department, and they go to the reception center, do you then determine the placement, or does a judge say that they should be placed in a group home, for instance, or a limited secure facility?
Judges have a variety of ways of making placements to OCFS. Judges can place with OCFS for replacement with a voluntary agency. And that's the majority of placements.
Okay.
And then OCFS would place them in a voluntary agency. And sometimes the judge would indicate a preference of a voluntary agency. If the judge places directly with OCFS, then we determine whether the young person will go to a non-secure or a limited secure based on an assessment of their needs.
Thank you. Now, we've talked briefly about Renee Greco. We all agree that it's a tragedy. I'm looking, some of these are from memory, some are some articles that I have in front of me. A Rochester police officer shot by an AWOL youth, a youth arrested for shooting in Middletown, a youth discharged from a home arrested for murder in New York City, a rape committed by somebody just released from a facility, and there's a number of others. And I also go back to 1987 when 2 priests in Buffalo, New York were murdered. One of the defendants was somebody that was, and I may have the classification wrong, an elopee or AWOL from a youth detention facility. The common denominator in all of this is the Office of Child and Family Services, and either a lack of rehabilitation or somebody escaping or lack of supervision. Along those lines, we see incidents where we have assaults on staff, juveniles assaulting other juveniles, increases in workers' compensation costs, and so on. And throughout this, here's where I'm going to with my question. What are you doing yourself? And if you had some successes, please talk about them. But what are you doing, and what is the department doing differently than you've done in the past to prevent incidents like this, to protect the community, to protect the juveniles that are placed, and to protect workers? And what plans do you have to have greater success in this area in the future? And how does the budget impact all of that?
Well, as you've heard, this is a centerpiece of the governor's reform efforts to redesign government, and this budget is key. We can't continue to do what has failed, and the governor has recognized that our system has been broken. And his proposal, as contained in the budget, is to really move toward improving and redesigning our juvenile justice system.
But I understand, but what specifically will you do differently to make our community safer, to make these homes safer, and to rehabilitate some of these troubled youth?
We are transforming the juvenile justice system to make sure that we have the resources to be able to provide the types of services that these young people need in order to be able to address the issues that they have. We have provided over 774,000 hours of training to our staff, and we will continue to provide training. We are moving to a more rehabilitative, therapeutic model designed to address the mental health needs of these young people, the substance abuse needs of these young people, so that they will be in a much better place to return to the community and ensure public safety. We need to do what works, because what works will preserve public safety.
Now, my background is law enforcement, and I full well recognize the need to work on prevention. I recognize the mental health needs. I recognize the need that we have early education to be able to prevent these things from people from being placed. And when we look at the budget regarding youth and family services, in the complete elimination of funding and the creation of the proposed primary prevention incentive program, block grant, going from the specific funding to competitive-based, and I think the words used are on evidence-based. Surely, some of the programs that haven't been funded, and I have firsthand knowledge of some of them, are evidence-based and have been successful, yet we're moving forward into essentially an unknown area. How do you make this transition and ensure that we have evidence-based programs that have been successful and will continue to be successful at a higher level?
There will be standards that will be promulgated to ensure that programs must prove and show that they're evidence-based, that they're employing best practices, and that they have proven results. That really is the intent of the Primary Prevention Initiative Fund.